Welcome to our 8-week Family Caregiver Education Series, hosted by the Central Okanagan Hospice Association in partnership with Vantage Living and Jumpstart Communications. Through challenging times, and especially during this pandemic, we know family caregivers are carrying more responsibilities in caring for their loved ones, carrying more stress with varying restrictions in place, and some having to make some life-changing decisions to be closer to their family. Through this 8-week Caregiver Education Series, we hope that family caregivers will be able to build confidence, resiliency, skills, and learn more about self-compassion and self-care. We call this filling up our toolkits. The Central Okanagan Hospice Association has been providing supportive care programs and services to individuals living with a serious illness and supporting their families along the way for 39 years. This may be through our community hospice visiting program, wellness program, vigil services, or providing grief support. Our programs complement the medical care to bring an integrated approach to palliative care by providing emotional, social, practical, and spiritual supports with trained, compassionate, and dedicated volunteers and our professional staff. All of our services are offered at no cost, so there are no barriers to access our services when and where needed, thanks to the generosity of our community. The Koha Aga Center is located on Cooper Road, and we have a lending library full of resources and great reading materials for family caregivers. Today's topic is nutrition and hydration, presented by Noelle Pascoe. Noelle earned her Bachelor of Science in Nutrition with great distinction from the University of Saskatchewan, with internships within the Regina Qu'Appelle Health Region and the State University of New York in Geneseo. Noelle is a proud member of the College of Dietitians of BC and Dietitians of Canada. She works full-time in long-term care for Vantage Living, primarily at homes in Kelowna and Longby.
So, good morning, everyone. My name is Noelle Pascoe, and I'm a registered dietitian. I work for Vantage Living and long-term care, and I'm here to speak on nutrition and hydration for your loved ones. So, some of the topics we will discuss today will include the overall importance of nutrition, as well as how nutrition changes in the aging and illness process. We will touch on specific nutrients that may be of concern, and I will give you some tips to maximize your loved one's nutrition. Then we'll get into some deeper topics that include dysphagia, which is a difficulty in swallowing, as well as artificial nutrition and hydration. And lastly, we will talk about nutrition at the end of life. Food and nutrition play a varying role in the aging and illness process. Early in the disease process, nutrition can help support your loved one, help manage symptoms like constipation, and prevent complications like infections. As your loved one advances in their disease process, the role of nutrition and food will change as they get closer to the end of life. This means the support you provide to your loved one in regards to nutrition will be different depending on where they are at with their disease or aging process. We will begin by discussing the importance of nutrition earlier on in the disease and aging process. And at the end of the presentation, we will discuss nutrition at the end of life. So, earlier in the disease or aging process, good nutrition is important for maintaining normal body function, such as making our heart pump and our lungs breathe. Good nutrition is also important for immune function, meaning when your loved one has good nutrition, they have an improved chance of fighting infections. Good nutrition is also important for maintaining healthy skin integrity, meaning preventing any sort of skin issues from developing, as well as healing any skin issues, such as pressure or bed sores, if they have developed. Good nutrition also helps to provide adequate energy and maintaining muscle strength. This increases your loved one's ability to maintain the ability to walk and participate in activities of daily living, such as dressing and bathing and so on. Good nutrition is important for the body to heal or repair. For example, if your loved one was to have a fall and fracture, they're more readily able to heal from that fracture with good nutrition. Nutrition is also important in reducing the incidence of dehydration, bladder, and bowel problems. So getting enough fluids and fiber is important in preventing issues such as urinary tract infections and constipation. Lastly, nutrition is very important in maintaining your loved one's body weight. Getting enough food or calories is important in preventing weight loss. Unintended weight loss is associated with an increased morbidity and mortality. And what that means is a decrease in your loved one's health and well-being and an increased risk of death. So we understand the biological reason we need to eat is to provide our bodies with nutrients to promote good health and provide energy. But when a body is no longer healthy, nutritional requirements dramatically change. Your loved one's nutrition needs and goals at the beginning of their disease diagnosis differs greatly from the nutrition support provided at the end of life. We will now discuss how aging and some disease processes can affect nutrition. So as we age, our appetites tend to decrease. There are a variety of reasons why this happens. So the general aging process is a big one. Also, feeling unwell or ill can certainly decrease an appetite. Unmanaged pain can also significantly affect one's appetite, as well as medical conditions and subsequent treatments, such as maybe radiation, can all contribute to a poor appetite. Medications can also decrease appetite, either as a side effect of the medication or if there are multiple medications. So your loved one may have simply filled up on medications and have no appetite left to eat, meaning they're taking a handful, and literally a handful of medications. This can certainly fill them up and take away their appetite for food at any meal. Over time, this decrease in appetite can lead to poor food intake and eventual weight loss. So let's pause for a minute, and I encourage you to use the chat and let me know some of the factors you find impact your loved one's appetite.
We have a question here regarding radiation and cancer. Also, too tired to eat enough?
Okay, yeah, some good responses here. So radiation and cancer definitely can, certainly affect that appetite. Too tired to eat enough. So fatigue, certainly. Uninterested in surroundings, that's true. So hopefully we can touch on some of these things. Unable to swallow. So definitely we'll talk about dysphagia, or that difficulty in swallowing. These are great, you guys. Good, so hopefully I can touch on those. So dentition changes can also affect nutrition. Your loved one may experience tooth loss, reduced saliva, poorly fitting dentures, mouth sores, which can all affect nutrition status. For example, think of when you have a toothache or even a canker sore. It can be everything from mildly uncomfortable to extremely painful. So for someone with, let's say, dementia that's not able to verbalize their concerns or how they're doing, if they have a toothache or not able to tell you, their food and fluid intake would significantly be decreased, or they may even refuse to eat altogether. Altered taste can also affect nutrition. So as we get older, it can get harder to notice different flavors. Taste buds actually shrink and become less sensitive, with sweet and salty flavors weakening first. Medication can also affect how your taste buds pick up flavors, making you less sensitive to taste, or they can even leave a metallic or bitter or sweet taste in the mouth. Other medications can cause dry mouth, which keeps flavors from actually reaching your taste buds. These changes can all minimize the enjoyment of food and eating. So as we get older, the body's signals tend to become a bit weaker, and this includes the signal for thirst. So often by the time your loved one may feel thirsty, they could already be dehydrated. Some medications can also cause dry mouth, which makes eating a very unpleasant experience. As we age, with some diseases, our sense of smell decreases, which certainly detracts from the enjoyment of eating. Just imagine the aroma of freshly baked bread or cookies. It definitely increases your desire to eat that food. Eyesight also decreases with age and can also be impacted by conditions such as macular degeneration or cataracts. Your loved one may be less able to see or recognize the food, and also may be less able to feed themselves if they're having difficulty with their vision. Also, as we age, our digestive system starts to slow down. When we are less physically active, our digestive system generally is less active as well. As we age, our stomach produces less stomach acid, which affects the body's ability to digest and absorb nutrients. Some pain medications can also impact our digestive system, causing indigestion like heartburn, upset stomach, or constipation. Antibiotics, especially with prolonged use, can also disrupt our natural gut flora, or the bacteria that's found in the gut, which can disrupt our digestive system, potentially causing diarrhea or constipation. And all of these digestive upsets can in turn then affect your loved one's nutrition intake. So by the age of 70, strength and muscle mass decline by about 40%. So this not only affects your loved one's ability to stay active, but can also affect their ability to complete activities of daily living. This would be things like dressing and bathing, like I mentioned. Also as well, the muscles involved in chewing and swallowing can also be impacted. Dysphagia, or a difficulty in swallowing, will be discussed later on in the presentation. So as a disease progresses, the body's metabolism can either increase or decrease. So towards the end of life, metabolism, or calorie needs, dramatically decrease. Physical activity levels will often decrease, resulting in decreased calorie needs each day. Or your loved one may no longer be mobile, which then would decrease the need for calories. But in some other cases, we have an increase in physical activity. For example, for someone with dementia that's constantly pacing or wandering, we would see an increase for calorie needs there. And your loved one's mental state can also be impacted by their disease, diagnosis, or progression. Fear of dying, the feeling of loss of independence, or the loss of family and friends if your loved one is in their later years. With these impacts on mental health, you will see a decrease in appetite, disinterest in food, or a general failure to thrive with your loved one. I encourage you to use the chat again here and let me know if you have found any other factors you find that affect your loved one's intake that I have not mentioned. No longer interested in the foods they used to love. Definitely. So we'll definitely talk about trying to maximize intake, and a lot of that is surrounding those foods that they used to love. But when that's not the case, we kind of need to step outside that box and, maybe try foods that weren't always those favorite foods. So hopefully I can kind of spur on some ideas today with maybe some different foods that are outside of that box. So now we'll move on and talk about some specific nutrients of concern. So your loved one may become deficient in one or more nutrients, particularly if their intake is poor. Each and every nutrient plays a unique but vital role in our daily functioning. Thus, a deficiency in one nutrient may appear very different from a deficiency in another. For example, a vitamin B12 deficiency may impact your mental function. And on the other hand, a vitamin C deficiency would inhibit wound healing. So two very different vitamins with two very different but still important functions. So we will discuss some of the top nutrients that may be of concern. For time's sake, I've limited it to about 9, but there are certainly more outside of this list. So we'll start with fiber. Fiber is a type of carbohydrate that the body can't actually digest. So that's sometimes why we see it looking very similar in the toilet as it looked when it was going into our body. It plays a role in digestion, helping us feel full after eating, preventing constipation, and even reducing the risk of chronic disease like heart disease, diabetes, and even some types of cancer. And actually 95% of adults aren't actually getting enough fiber. Too little fiber can cause constipation or even an increased risk of chronic disease like heart disease and diabetes. But too much fiber can cause digestive issues, including bloating, gas, and cramping, especially if fiber is added to the diet too quickly. So we want to make sure when we're increasing fiber, we do it very gradually, as well including fluid alongside that gradual increase in fiber. So on the left-hand side there, you'll see some of the foods high in fiber. So legumes would be foods like chickpeas, lentils, beans, black beans, brown beans, kidney beans, peas like split peas, almonds, quinoa, broccoli, apples and bananas, and whole grains like oats, whole wheat bread, wild or brown rice, those sorts of things. So another important nutrient is protein. Protein is a macronutrient and is found in every single cell of our body. It aids in immunity, maintaining muscle, and maintaining physical function. So as I mentioned before, loss of muscle mass can lead to frailty and loss of independence that's associated with your loved one not being able to complete those activities of daily living. Protein and calories are important in protecting muscle mass. So too little protein can cause malnutrition and or even muscle loss. However, too much can cause dehydration, and in those with kidney disease can further kidney damage. Specific protein needs may vary from condition or disease process, but there is emerging research suggesting older adults may need more protein from what the current recommendation is. Some of the foods highest in protein come from animal sources, such as animal meats, eggs, and dairy, as well as legumes and nuts. Fruits and veggies and grains also contain protein, just not as much as some of those animal products. If your loved one follows a vegetarian diet, they should be sure to eat a wide variety of plant-based high-protein foods throughout the day to ensure they're getting enough of the right kinds of protein. So next, we'll talk about calories or energy. We'll use those two words interchangeably. So when we do not consume enough calories each day, it can lead to weight loss. Significant weight loss is associated with poor outcomes. And what that means is it's associated with things like developing pressure sores or bed sores, an increased risk of infection, a functional decline, as well as a cognitive decline, and a general increased risk of death. So when your loved one begins to lose weight unintentionally, meaning they don't mean to lose that weight, they are often losing muscle. When this happens, providing calories is key. Calories stop that unintended weight loss. Again, we want to stop the unintended weight loss to preserve the muscle mass and maintain their independence. So later on, I'll discuss some strategies to help increase calories in your loved one's diet. Next up, we'll talk about fluids. So fluids are essential to life. They help us to think clearly and keep our body temperature where it is supposed to be. They also help the bowel stay regular. Even mild dehydration can lead to some constipation. As we get older, the body's signals tend to become a bit weaker, meaning your loved one may not know when they are thirsty. And by the time they feel thirsty, they could already be dehydrated. Being dehydrated can also make them dizzy, which can increase their risk of falling. It will be important to encourage fluids regularly throughout the day. So we want to shoot for a goal for women to aim to consume just over 2 liters a day and men about 3 liters a day. But keep in mind, this is fluid, so not just water. There are many foods that we eat that are very high in water that will help contribute to that daily fluid need. So think of things like soup or watermelon have a really high water content. Remember, we want to encourage your loved ones to drink more when it's hot outside. So maybe not a day like today, but some of those warmer months. If they're doing any sort of exercise, or if they have been vomiting or having diarrhea, we definitely want to make sure we're replacing those fluid losses. Your loved one's fluid intake is probably okay if the urine is slightly yellow or colorless. Keep in mind with this though, some vitamins and medications can cause the urine to change color. Later on, I'll discuss some strategies to help your loved one drink a bit more. So vitamin D is involved in bone health, muscle health, immunity, and reducing inflammation. It's famously known as the sunshine vitamin, as it's the only vitamin that our bodies can create when we are exposed to the sun. As we age, the risk of vitamin D deficiency increases, not only due to decreased sun exposure, but also because the skin cannot make vitamin D efficiently as it could before. Other things can impact absorption of vitamin D from the sun, including having darker skin complexion, wearing sunblock or protective clothing, or even how far you live from the equator. So even though vitamin D is that sunshine vitamin, we don't want to bank solely on the sun for providing us with this vitamin. So most people only get about 10% of the recommended intake for vitamin D from foods. And this is because mainly very few foods actually contain vitamin D naturally. So natural food sources of vitamin D would be things like salmon, sardines, shrimp, and fatty fish skin from cod, tuna, and mackerel or fish liver. So, some of those foods we might not be eating very often. And we do have smaller amounts that are found in things like beef liver and egg yolks and even mushrooms. But fortified food sources of vitamin D might be things that you would consume a bit more readily. And fortified food sources just means that the food manufacturer has added the vitamin D into the food or the drink. So this would include things like milk, cereal, yogurt, even orange juice or tofu. If your loved one is consuming milk alternatives like almond milk, cashew milk, or oat milk, and so on, those kinds of milk alternatives, we want to make sure to check the nutrition facts panel to make sure it contains vitamin D. In Canada, only cow's milk and soy milk are regulated to be fortified with vitamin D. I would say nowadays, many of the milk alternatives like almond milk are fortified, but it would be a good idea just to take a peek at that nutrition facts panel. If your loved one is not able to get enough vitamin D, they may need to take a vitamin D supplement. And your loved one's healthcare team can recommend if that supplementation is recommended. So now on to calcium. So calcium and vitamin D go hand in hand. Both are important for bone health. Calcium is a mineral involved in bone health as well as muscle health, nerve transmission, and hormone secretion. Lack of calcium can cause weak bones and fractures, whereas too much calcium can cause kidney damage or kidney stones. Some food sources of calcium would be, we most notably relate to milk and milk products like yogurt, kefir, or cheese. Calcium fortified milk alternatives such as soy milk, even fish with bones. So think of like a can of salmon that has bones in it. If we grind those bones up and consume them, that would be a good source of calcium. And then some of our nut butters, so almonds and almond butter, sesame seeds and sesame butter actually can be a source of calcium. Sesame butter, you might not be too familiar with, but it is actually what's used in making hummus. It's tahini. And there's a small amount of usable calcium in foods such as turnip greens, kale, broccoli, bok choy, and whole grains. So for those maybe of the loved ones that don't consume dairy, we just want to be mindful to consume plant-based foods that are high in calcium and other calcium fortified foods or beverages. So thinking like fortified cereals or milk alternatives, that sort of thing. So vitamin B12. Vitamin B12 is needed to form healthy red red blood cells, and that's what carries oxygen around our body. And it also helps keep our nervous system, which is kind of the general control center of the body, working properly. And actually, as we get older, and when it comes to B12, it's most notably over the age of 50 years, our body's ability to absorb vitamin B12 naturally found in food actually starts to decrease. So that's why it's recommended that most older adults get at least half of their B12 through fortified foods or supplements. So like I mentioned before, fortified foods, meaning foods where vitamin B12 has been added in. So for example, some breakfast cereals or some of those non-dairy milk alternatives like soy milk or almond milk would have the vitamin B12 added to them. Too little vitamin B12 can cause a myriad of issues. So anemia, fatigue, stomach issues, constipation, unintended weight loss, even some neurological changes or confusion, and even a sore mouth or a sore tongue. And it's pretty unlikely that someone would get too much vitamin B12. So we're more concerned about someone not getting enough. And vitamin B12, when we look at the foods that it's found in, it's primarily in animal products. So like I said, those people that are over 50 years of age, and maybe those that don't consume animal products or maybe consume very little of them, we really want to be mindful that we consume fortified sources of vitamin B12 and or we take a supplement as well. All right, so the last nutrient we'll talk about is vitamin B6. So vitamin B6 plays a role in metabolism as well as supporting immune function and brain health. The need for vitamin B6 increases when we are over 50 years of age. So vitamin B6 is actually found in a pretty wide variety of foods, things like animal meats, fruit, veggies, whole grains, legumes, seeds. And generally, if we're eating a well-balanced diet with a variety of foods, we can often get in all the vitamin B6 that we need. A lack of vitamin B6 can cause anemia, cracks in the corner of the mouth, even depression or poor immunity. And like B12, vitamin B6 is pretty rare that we get too much of it. But we do want to pay special attention as the increase actually increases as we get older. Okay, so now let's get into some strategies to help maximize your loved one's nutrition. So if your loved one's experiencing some of that poor appetite that we discussed previously, we want to try for small, frequent meals of their very favorite foods. So, even if they're being turned off by some of those favorite foods, we still want to offer maybe a different variety of foods, but we want to offer small, frequent kind of mini meals throughout the day. We want to try for calorie and protein rich foods first at a meal. We want to try and maximize when there is an appetite. So let's say if they finally kind of get their appetite going by later in the day and they're eating then majority of their food later in the evening, that's okay. Or maybe after they have a bowel movement, if they're constipated, that might be when they kind of get their appetite back. So we want to maximize on those times. We can try even spicing up the food, so nothing can kill an appetite like bland food. And we really want to try to encourage drinking fluids between our meals rather than with the meal. When we drink things like water, tea, or coffee, it can make your loved one fill up faster. So we want to try and encourage those fluids to be between the meals so that during that meal, we kind of maximize all the nutrition with food. And we want to encourage physical activity if this is possible. So if your loved one is able, we want to encourage a little bit of exercise as this can sometimes help stimulate the appetite. Sure.
So we have a question here asking, would you recommend anyone over 50 to be taking a multivitamin to ensure they get all their vitamins if they aren't eating as well as they should be?
So that's a great question. I would say we do want to turn to our healthcare practitioners with your loved one, just because everyone's kind of disease prognosis is going to have different recommendations. So I want to say kind of first off, we do want to turn to that healthcare practitioner just to make sure that, some of our conditions we want to avoid certain nutrients or timing of certain nutrients with medications, things like that. But to answer this in a very general sense, beyond that, if we do have poor intake, a multivitamin could be something that's utilized. A way, if you're not really sure about your loved one's nutrition intake, food journaling for a few days, and using, there are some kind of handy apps out there that track our micronutrients. So it'll track the amount of calories that we consume, as well as, the protein and the carbohydrate and the fat, but also then tracks all of the micronutrients. So all of our vitamins and our minerals. And that might give us a better perspective on, where our calcium intake's at, where that B6 is at, right? So, I'm trying to think of a kind of a general resource, one that's free, an online, it's an app or a website. It's called Chronometer. And that can be something that, for a couple days, you try and jot down what your loved one's eating and drinking, and you can pop it into that website. And then that gives you a better idea. And that might even be some valuable information that you take to your healthcare provider to say, look, my loved one is really struggling, and we're having a tough time with, getting enough to eat and to drink. And this is where kind of we're at. So that can guide you and your healthcare practitioner to see if a multivitamin is necessary, or if maybe just an individual nutrient is, or vitamin is necessary. So if we just want to, take an individual calcium supplement, let's say, or an individual vitamin D sort of thing. Good. Okay, hopefully that answers that question. So now on to constipation. So keep in mind, everyone's bowel schedule is different. When you are regular, you may go, let's say, 2 times a day, whereas your loved one's normal may be every couple days. So when there are changes to this normal pattern, that's what would indicate constipation. Constipation can also take on different forms with different people. So your loved one may not be having a bowel movement for several days, or maybe their stool is very hard to pass, or they might even just have the feeling of not being able to completely empty their bowels. So constipation can be caused by not consuming enough fiber or fluids, too little physical activity. So when we start to physically slow down, our bowels kind of start to slow down as well. Constipation can also be caused by side effects from medications. So this would maybe be something like an iron or calcium supplement. Pain medications can often cause constipation. So we want to focus on eating more fiber. So like I said before, big sources of fiber in a general sense would be fruit and vegetables, whole grains and legumes, as well as nuts and seeds. And like I said before, we want to start really slow with fiber, and we want to gradually increase it. And when we're gradually increasing that fiber, we want to make sure that there's fluids there as well. Or else if we're just increasing our fiber content and not drinking enough fluid, that can sometimes make constipation worse. So if we are eating more fiber and drinking more fluids and that still doesn't help, we can try offering natural laxatives such as prunes or prune juice. And actually on the next slide, I have a recipe for something called Fruit Lax, and it's just a homemade high fiber natural laxative. And then the last thing I want to say is, we do want to try avoid using any sort of fiber supplements or store-bought laxatives right away. So we want to try and kind of make diet changes first. And if that doesn't work, then we're going to talk with your healthcare provider about whether laxatives and which kind would work best for your loved one. So here's the recipe for Fruit Lax. It's a fairly sweet sweet product that you can make at home. Some folks will put it on toast, maybe on ice cream, even in their porridge in the morning, even in yogurt. And I even have had people put it in their tea. So that can be something that you can experiment with. So some tips for nausea and vomiting. So very similar to our tips for poor appetite, we do want to have small snacks and meals throughout the day. So we want to try and eat every 1 to 2 hours. Sometimes when we get overly hungry, this can kind of increase that nausea. And And we want to eat when we're not feeling nauseous. So again, we just want to maximize on that time when there isn't nausea. And we want to eat bland foods here. So I know this is the opposite recommendation for poor appetite, but sometimes when we have really spicy foods or flavorful foods, sometimes that doesn't help with nausea and vomiting. We want to try to serve foods that are at room temperature or cold. Strong smells that come about in the cooking process can sometimes induce nausea. And we want to limit sights and sounds and smells that may trigger that nausea or vomiting. And if your loved one is vomiting, we do want to make sure that we're replenishing all of those fluids that are lost. So for dry mouth and taste changes, so here we want to make sure we maintain good oral hygiene. And if your loved one's mouth is dry, we really want to take extra care to clean the teeth to prevent any sort of decay. Saliva actually keeps our pH in our mouth pretty neutral, and so it's going to stop any sort of harmful acids from affecting the teeth. So we want to make sure that if your loved one is experiencing that dry mouth, that we're taking care of their teeth. There are some products out there that can address dry mouth. For example, something like biotin comes in sprays, mouthwashes, gels, or toothpaste. We can offer ice chips and popsicles or moistened mouth swabs. We want to make sure we keep the lips nice and moistened with a lip balm. And if food does not taste good, we can try kind of rinsing the mouth before eating to remove any sort of the bad taste. And if the food is tasting metallic, we can try and use plastic cutlery or kitchen utensils. And we want to try offering food that's room temperature. So we want to avoid things that are hot or avoid things that are really cold. We can experiment with like some new seasonings like herbs and spices, garlic, onions, mustard, ketchup, barbecue sauce. And if the mouth isn't sore, we can even try experimenting with some acidic seasonings like lemon juice or vinegar, as they also add some flavor. And if your loved one is experiencing some bitter taste, you can try adding a little bit of extra sugar to kind of counterbalance that. And then after eating, we want to offer some sugarless mints or chewing gum to help, or even just rinse the mouth out to remove any sort of leftover tastes that are in the mouth. So some tips now to boost calories. So we want to try increasing calories by offering foods that are energy dense, meaning they have lots of energy or calories in a very small volume. So for example, if we look at a half a cup of chicken, it's going to provide much more calories than a half cup of spinach, even though they are the same volume. A really important strategy to try here is to try and increase calories by adjusting the recipes of your loved one's already favorite meals. So we want to increase fat and protein. And when we're choosing foods that are high in fat, it's best to choose options that are really pretty minimally processed. We want to think of nuts, olive oil, eggs, that sort of thing. In addition to help providing more calories and helping your loved one gain weight, these foods are also going to have a few more benefits from their vitamins and minerals. And for protein, we want to follow a similar guideline as well. We want to choose foods that are pretty minimally processed. So we want to think of things like milk, yogurt, especially Greek yogurt. It's quite high in protein, meat and eggs. They are going to pack protein alongside other nutrients. Protein powders can also be an easy way to increase calories and protein if that's something that is available to you. However, the overall focus should be on quality of life and the foods your loved one wants to eat. So even if processed foods is all they can eat, that is okay. So by the time they, have an appetite or have a desire to eat and they're requesting a McDonald's cheeseburger, that is okay. So touching a bit more on fat. So fats are more calorie dense than protein or carbohydrates. So what this means is that in a really small volume, you still get a large amount of calories. And they're actually 2 times as dense as protein and carbs. So a little bit actually goes a really long way. So some good sources of fat would include nuts like walnuts, almonds, peanuts, nut butters like peanut butter or almond butter, oils like olive oil, avocado oil, that sort of thing, and butter. So milk and alternatives are high in protein and can also be high in fat. And in this category, we want to look for high milk fat percentage or high MF percent. So we really just want to avoid fat-free or kind of lower milk fat percentages. So if we're looking at like cow's milk, let's say if your loved one drinks cow's milk, we want to avoid the fat-free and avoid the 1%. And we want to shoot for maybe more of like a 2% or 3% whole milk. And same with the cheeses, we do want to avoid any sort of reduced fat cheese. When it comes to the meat and alternatives, they're going to provide protein, energy, or calories, as well as some of the vitamins and minerals. And we don't want to be afraid of higher fat animal meats here. So, for example, a chicken thigh is going to provide more calories than a chicken breast, just because it has that higher fat content. So fruits and veggies are high in a variety of vitamins and minerals, but they are not really a calorie-rich choice. You can try and enhance the calories by adding maybe a bit of fat or sauces or cheese, adding those kind of higher calorie options to them. But there are some higher calorie fruit and veggies, and this would be things like avocado, bananas, dried fruit are higher in calories, potatoes and sweet potatoes, green peas, edamame beans, those would all be some higher calorie options. And then when it comes to grains, we want to provide, they're going to provide primarily carbs, which include fiber and vitamins and minerals and some protein. So this would be things like we talked about, whole grain breads, oatmeal, quinoa, rice, brown rice or wild rice, that sort of thing. So if we can try and increase calories here, we can, I would say maybe try adding some fat. So if you've made some pasta, we want to, put a bit more olive oil on that pasta maybe. So now some ideas to boost calories at breakfast. So if your loved one enjoys hot cereal like oatmeal or cream of wheat, when you're making that oatmeal or cream of wheat, we want to try and use cream instead of milk or water. And we want to focus on adding in some high calorie options. So things like dried fruit, raisins or dried cranberries, that sort of thing. Bananas, adding in a bit more butter once that hot cereal is made, top it with some brown sugar, maple syrup or honey, even adding things like almonds or flax seeds or chia seeds also provide some healthy fat, but there's also going to be some great fiber there if they're struggling with constipation. Even adding in things like coconut can be a nice treat. And we can even experiment with something like overnight oats. So overnight oats are a way to pack in lots of this good nutrition in oatmeal, but it can be prepared the night before. So if maybe you don't have the time when you're caring for your loved one, or it's an easy thing that they can grab out of the fridge in the morning and just kind of enjoy, that can be something to look at too. I do believe in the resource list in the toolkit, there is a link to some great websites. One of them I do believe is the BC Cancer Agency, and they have some good recipes for overnight oats. So eggs. So if your loved one enjoys eggs, we want to maybe make sure when we're preparing those eggs that we're using butter in the pan instead of a spray. So instead of using PAM, don't be afraid to use a bit of butter in that pan. And then adding in things like butter to the eggs, as well as cream or cheese, maybe sour cream, avocado, or even some breakfast meat. So for example, if you're making an omelet, we want to make sure we coat the pan with lots of butter. We can add in some cream to the eggs, fold in some cheese, top it with some sour cream or avocado. And then if we're looking at some of the baked goods, so let's say you're making pancakes. So again, we want to use some butter in that pan instead of a cooking spray. And we can use whole milk or cream instead of water when we're making the batter. We can even add in some dried fruit or chocolate chips maybe. And then don't want to be afraid of topping it off with some butter or some syrup. Okay, so smoothies are a great way to pack in lots of nutrition and are often easily tolerated. To make some higher calorie smoothies, we want to try adding things like bananas, using cream maybe instead of a lower fat milk or water, using a full fat yogurt or cottage cheese for some protein. Avocado and peanut butter provide some extra fat there, maybe even some chocolate sauces to make it more enticing for your loved one. We can also add in protein powder if that's available to you and you don't have some of the protein sources like the yogurt or the cottage cheese. And then flaxseed and chia seeds also can help add a bit of flavor to the smoothie, but also can help with that constipation if that's an issue. And then on the next couple slides here, there are some recipes for some smoothies. So this comes from the geriatric dietitian. It's a great website. And these are some of her high calorie smoothies. So you'll notice they're not a huge ingredient list, but definitely packing in a lot of calories and kind of a variety of different items in those smoothies. So that's on the geriatric dietitian website. Okay, and so on to beverages. So again, here, when we are hydrating your loved one, we want to focus on, it's important to keep them hydrated, but if they are struggling with weight loss, we want to make the fluid choices as kind of calorie dense as possible. So like we talked about, doing high calorie smoothies, also high calorie milkshakes can be a great option. If your loved one enjoys drinking milk, we can try and kind of fortify that a little bit. So maybe you have a 1% at home or even just 2%, fill that cup 3/4 full and then top off with a bit of cream to kind of help increase those calories. Maybe even a high calorie hot chocolate. So we want to use that full fat cream there. Don't be afraid of the whipping cream on top. Might be nice on a day like today. And then commercial nutrition supplements like Boost or Ensure can definitely be a convenient option that's going to pack a lot of nutrition in a small portion. But you can certainly make something just as nutritious or even maybe more nutritious with making some of these calorie or nutrient dense swaps with some of the foods that you might already be making. Some of the folks that I work with love the nutrition supplements, and some caregivers do find it to be an easy option to have available for their loved one. So that is an option. Okay, so tips on hydration. So like I mentioned before, hydration isn't just plain old water. Milk, water, juice, smoothies, they're all going to provide hydration. And we want to consider the fluid content in some of the foods that you're offering. So like I mentioned before, we want to think of things like soup, or a big majority of our fruits and vegetables actually have a really high water content. So that's something that we can focus on if you're having trouble with your loved one just drinking fluids on their own, is focusing on the foods that have a really high water content. We want to offer small amounts frequently throughout the day. And we want to make it easy to access. So this might mean having a water bottle available for your loved one. This might even act as a visual reminder to them. And it might even be a way for you to track how much they're actually drinking. And you might even have multiple water bottles around the house just to make it really convenient for your loved one to drink. And we do want to avoid carbonated water. So on the market nowadays, I find there's quite a few kind of fancy carbonated waters out there. These can be fun, but they also can fill up your loved one much sooner. That doesn't leave room for a lot of other fluids or foods. So we kind of want to avoid those if we're struggling with hydration or getting enough to eat. Okay, and just a few more kind of general tips here. So anything goes. So this really means, if your loved one wants dessert for breakfast, that's okay. They're willing to eat that. Your loved one might not have a difficulty in swallowing, but they might be easily fatigued by chewing. So in this situation, we can offer foods that are pretty easy to chew, or maybe even just naturally pureed, like mashed potatoes or pureed soups, puddings, smoothies, milkshakes, that sort of thing. And that's going to allow your loved one to actually consume more nutrition without getting fatigued by simply chewing and eating. We want to offer seconds, even if it's just for one part of the meal. So maybe your loved one just ate the mashed potatoes, but left the meat and the vegetables. We want to offer more of those mashed potatoes. And we want to try not to overwhelm them with too many choices. So when there's multiple options or items placed in front of them, it can be totally overwhelming and they may just kind of decline to eat altogether. And this is something that's very common with those folks with dementia. And lastly, and most importantly, we want to listen to your loved one. So food is more than just calories, the protein, the vitamins, and the minerals that I've mentioned. It's social and it's emotional and it's cultural. So for centuries, food and drink have played a significant role in the socialization with our society. Food can symbolize many different emotions, love, happiness, caring, as well as some negative emotions as well. And we often typically associate food and drinks with different kind of pleasurable activities or holiday meals, something even like a birthday party or childhood memories, so on. So we do want to acknowledge that, food has this significant kind of emotional and cultural tie. I encourage you to use the chat box again here now and try and name some social activities and food or drinks that we often associate them or that your loved one would associate together. So I mentioned birthday parties, so maybe that's birthday cake, or maybe your mom, or loved one always made a special birthday cake for you. Another kind of event that's coming up would be Halloween. So, Halloween is, I would say, probably associated most greatly with candy and chocolate. So yeah, use the chat box and let me know some of those kind of social activities and maybe the food or drinks that your loved one is always associated with that. Oh yeah, hot chocolate when chilly. Cool. That's a great one. An anniversary celebration. That would be really special, yeah. More stews and soups during the winter months. Great, that's a good one. So yeah, we want to kind of flex with the seasons. Good, awesome. Thanks, guys. Those are really good things. And I think that just makes us, think a bit greater and outside of just food as vitamins and minerals and protein, right? Food is those things, but food is also, a bigger concept. And we definitely want to acknowledge that, especially as we kind of get into our later years in life. So food is deeply embedded in many cultures, reflecting many of the important rituals and celebrations in a person's life. So we really want to embrace a holistic approach and recognize that food and drinks and even just the general dining experience in general influence not only our health, our physical health, but also our mental health, our emotional and our social well-being. Because food often symbolizes these emotions that we mentioned, maybe things like love or compassion, it may be really hard to see your loved one decline the food and drinks that you're providing. But as your loved one ages in their disease process, the role of nutrition and food will change as end of life approaches. The closer your loved one is to the end of life, we aren't as necessarily worried about, the nutrients and their intake and weight and so on. Remember, at this point, we really want to focus on quality of life rather than quantity of life. And of course, we want to always remember that at the end of the day, it is your loved one's choice, and we really must respect that choice. So moving on to dysphagia. So dysphagia, which is a difficulty in swallowing as a symptom of a disease. Occasional difficulty swallowing can occur maybe if we're eating too fast or we don't chew our foods well enough, or we're trying to talk as we're drinking. And this usually isn't cause for concern. But if we do have some persistent difficulty, that is a bit more serious and we should address it. Swallowing is definitely a complex process. So it's going to require coordination of many different muscles in the mouth and the throat, but it also involves nerves sending the right messages to the right place at the right time. So when we don't have any swallowing impairments, we often can take this process really for granted. So the causes of dysphagia can vary, and the treatment or management really just depends on that cause. So some causes of dysphagia would include neurological causes. So if there's damage to the nervous system that interferes with the nerves responsible for starting or controlling the swallowing. Some neurological causes of dysphagia could include sudden neurological damage, something like stroke or a brain or spinal cord injury that can affect the ability to swallow. Certain disorders that damage the brain and nervous system over time can cause dysphagia. This would include maybe things like Parkinson's disease, multiple sclerosis, muscular dystrophy, and dementia. Brain tumors can also cause dysphagia. And then there's also obstruction causes. So this would be, things like conditions that would cause an obstruction in the throat or narrowing of the esophagus. So the esophagus is the tube that carries the food from our mouth to our stomach. And if we have some sort of an obstruction there, that can certainly make it difficult to swallow. So some examples of or some causes of obstruction or narrowing could be certain cancers like laryngeal or esophageal cancer can cause some obstructions and make swallowing difficult. And typically once these cancers are treated, the obstruction might not be an issue anymore. But radiation therapy is another example. So when we do have radiation, this can cause some inflammation and scarring in the esophagus, which can lead to some difficulty in swallowing. And some other causes can include just a general kind of weakness as we get older. So the muscles that are used for swallowing can become weaker with age. So this kind of can explain why dysphagia is relatively common with our older people. As well as chronic obstructive pulmonary disease, or COPD, is a collection of lung conditions that make it difficult to breathe properly. So breathing difficulties can sometimes affect the ability to swallow. And dysphagia can also develop as a complication of head or neck surgery. So some of the signs and symptoms of dysphagia that we want to look out for when caring for your loved one is, I would probably say the number one thing we want to watch out for is coughing during eating or even after eating or drinking. Another, common symptom that we want to look out for is a wet sounding voice during or after eating. So it might actually sound like your loved one is underwater if they're, talking after they're eating or kind of during a mealtime. Some rattly or noisy breathing can sometimes be a symptom. Drooling, as well as some discomfort or pain when swallowing, or your loved one might be really hesitant to eat or very slow to eat and swallow. And they might even complain of a sensation of the food getting stuck in their throat. So they might, point to kind of areas in their throat or their chest or even kind of behind their breastbone or their sternum. They might even be bringing food back up, so there might be some regurgitation. They might be having frequent heartburn. Also, some excessive chewing can be common, or if they really are unable to swallow foods, they can store them in the cheek. So this is something called pocketing, and we do want to watch out for that. And then also selective eating or spitting out food is another sign. And another actually symptom of dysphagia can be that unexplained weight loss. So if left untreated, dysphagia can lead to malnutrition, weight loss, and dehydration, as a person isn't able to effectively get in all the fluid and food that they need. Choking can also happen, and this would be when food gets stuck in the airway, which can be fatal. And aspiration. So this is when food or fluids start entering the airway and the lungs. And this in turn can cause something called aspiration pneumonia, which can be fatal. So to help maintain optimal nutrition and hydration, sometimes the food texture or fluid consistency may need to be altered in order to help your loved one chew and swallow safely. So typically assessment and specific recommendations can be provided by a speech language pathologist or SLP, as well in the long-term care setting. A trained registered dietitian or an occupational therapist can also do these assessments. The health professional may recommend texture-modified foods, such as minced or pureed foods, to ease in a safer and easier swallowing experience. Thickened fluids might also be recommended for a safer, more pleasant drinking experience. Or the practitioner might just give your loved one some kind of general safe eating and drinking strategies for consuming the same, regular textured food and thin fluids, but just some strategies to help them swallow safely. And if dysphagia is something that is found by this practitioner, that health professional will be able to provide you with some more details regarding this. So if dysphagia is identified, the overall care approach and your loved one's goals would need to be revisited. Your loved one may choose to forego the modified diet, understanding the risks associated with doing so, and that needs to be respected. The risk of choking and or aspiration needs to be compared and weighed against the slow process of wasting away. Meaning the clinical recommendations by the SLP or the dietitian may be for a pureed diet with thickened fluids, but if your loved one absolutely hates those foods and stops eating, we're no better ahead. So your loved one may reject the texture modified foods or thickened fluids, but may enjoy foods that are naturally pureed consistency, like mashed potatoes, puddings, smoothies, milkshakes, yogurt, even things like hummus and guacamole. And even if dysphagia isn't identified, like I mentioned previously, texture modified foods may be of benefit if your loved one is finding fatigue with eating. So for example, if they're spending lots of time and energy just simply chewing, and they're becoming fatigued with only eating a small amount of food, if you're providing easier to chew foods or foods that are naturally pureed, like a smoothie or a pudding, your loved one might be less fatigued and they'll likely get in more food and fluids, and what that means is just more nutrition. So artificial nutrition and hydration. So artificial nutrition means tube feeding. So this is a way of getting nutrition directly into the stomach or small intestine. Artificial hydration would either be by intravenous, so IV, which is putting fluids right into the vein, or hypodermoclysis, which is putting fluid under the skin. Tube feeding may be clinically appropriate in certain circumstances. So head and neck cancer treatment, maybe post-stroke in some cases. These are just a couple examples. And tube feeding can improve nutrition status in those cases. If a feeding tube was appropriate and was chosen to be placed, your loved one would work with a registered dietitian, probably either in community or in the hospital, that would provide more information on this area. However, there is considerable data indicating that it is not beneficial to provide nutrition support for patients with an irreversible illness, so a permanent vegetative state or someone with advanced dementia, or a terminal illness, meaning death is anticipated within 6 months. Feeding tubes have not been shown to reduce the risk of aspiration. And again, aspiration was when we take food or fluids into the lung. So it's, feeding tubes aren't shown to reduce that risk or prolong life with those people with end-stage dementia. Artificial feedings and hydration do not always ensure comfort or reduce suffering. They may actually cause diarrhea, abdominal pain, local complications at the insertion site, and they may actually increase the risk of aspiration. So now to just touch on some of what the scientific research says when it comes to artificial nutrition at the end of life. Evidence suggests that providing nutrition support, meaning tube feeding, can contribute to increased suffering in terminally ill patients due to increased nausea, vomiting, bleeding, edema, pulmonary edema, incontinence, or infections, as well as potential requirement for patient restraint. A comprehensive study of nursing home patients with dementia reported that the insertion of feeding tubes did not improve survival over those hand-fed, did not lower the risk of aspiration pneumonia, and did not improve pressure ulcer healing, weight status, comfort, or functional status. Another study actually found that in nursing home residents with a feeding tube, they actually died 1.44 times sooner than those that did not have a feeding tube. So now to discuss nutrition at the end of life. The body of a person who has a life-limiting illness is in the process of shutting down. They no longer require a great deal of nutrients or calories, and therefore their appetite or desire for food will diminish. Your loved one at the end of life does not experience hunger or thirst in the way that you would. The loss of your loved one's appetite may be one of the most difficult symptoms you face. It is commonly feared that your loved one will starve to death or become dehydrated, or you may fear that your loved one will suffer. And in fact, the opposite is true. Although adequate end-of-life nutrition is important, if a person with a life-limiting illness in the later stages of their disease is forced to eat or drink when they do not feel they need to do so, they may experience physical symptoms that can cause more discomfort or complications. So these complications would include things like choking or aspiration, and this can be really distressing and painful to your loved one and can actually cause more symptoms such as shortness of breath and coughing. Also, gastric reflux or severe indigestion in extreme cases can also cause aspiration. Your loved one could also experience bloating or an uncomfortable feeling of fullness. This can lead to nausea and vomiting, abdominal distension, gas, diarrhea, or constipation. This can be especially painful to a person who is in the process of dying. Think of how it feels to be bloated or nauseous when you are completely healthy. For a person who is dying, it is much worse. So now to talk a little bit about edema. So when the body is dying, it's no longer able to regulate fluid in the body well. So fluid imbalances can arise, which can cause some significant symptoms. Edema, which is swelling, can occur in the feet, legs, and hands, and this can make it harder for the body to fight infections and heal wounds. But worse, it can cause swelling in the lungs, which is called pulmonary edema. So pulmonary edema can cause distressing symptoms like shortness of breath, coughing, and even the inability to get oxygen into the blood, which is something that's known as hypoxia. So hypoxia can actually cause your loved one to become confused, agitated, and even combative. So with hypoxia, their skin can also turn a bit of a bluish color. So we know that a person at the end of life does not get hungry or thirsty in the same way a healthy person does. We know that decreased appetite and the loss of thirst are natural processes that allow the body to prepare itself for death. For the person who is in the final stages of a terminal illness and close to death, there is no proof that increasing calories, meaning eating more food, will improve their strength, their energy levels, their ability to function, or even prolong their life. Trying to force a dying person to eat will not extend their life. The human body is amazing. It is learned during the dying process to reduce and eventually totally eliminate the need for fluids and food. As fluid consumption decreases during the dying process, this water deprivation actually increases the body's production of endogenous opiates that create a euphoric state, and this has been associated with a reduction in pain. Symptoms of dry mouth should be managed with ice chips, moistened swabs, and lip balm. So the loss of appetite and thirst is a natural process by which the body begins to prepare itself for death. Your loved one should determine what, how much, and how often they choose to eat or drink. Food and fluid should never be actively forced or actively withheld. Their bodies will tell them what they need and when they need it. And as hard as it may be for us, there may be a time when we need to find new ways to bring relaxation and serenity to our loved one. Just remember, as hard as it may be personally, this is really the best way to show your loved one that you care. Your loved one's expressed desire is a primary guide for determining the extent of nutrition and hydration. The difficulty, though, is sometimes in determining what those loved ones' desires are. So conversations about end of life should be initiated early in the diagnostic and treatment stages, rather than waiting until the dying process has begun. Ideally, there should be documentation through advanced directives outlining your loved one's beliefs, thoughts, and desires concerning care during the final stages of life. When end of life does come, there are too few precious moments to be had between you and your dying loved one. Issues around eating and nutrition can sometimes affect these precious moments. From the caregiver feeling guilt that they aren't giving enough food, where they maybe feel their loved one is going to starve to death, to the loved one who wants to please the caregiver, so they force themselves to eat and then they feel miserable. We need to remember nutrition should be supportive and enjoyable at end of life and should not take away from precious moments with your loved one. And remember, quality of life means different things to different people. In knowing this, there isn't one course of palliation for everyone. And ultimately, your loved one will take the lead and the care team will support your loved one based on their cues. Quality end-of-life care is a dynamic process that's negotiated and renegotiated among your loved one, family, and healthcare providers. Lastly, I want to make sure we cover taking care of yourself. Being a caregiver is hard. Dealing with end of life, whether it's a family member, a friend, caregiver, or healthcare provider, it's always hard, and it can take a toll on you. You can only take care of others to the extent you take care of yourself. Be sure to take breaks when you need them. Speak up and ask for help if you see no opportunities for a break. Make sure you get enough sleep, good nutrition, plenty of fluids, exercise, and take care of your heart and your brain. Thank you ever so much for this opportunity. And I think now we'll open up the floor for some questions.
One question that we had was, what type of protein powder do you recommend that has low sugar?
So in regards to protein powders and sugar, we want to look at what that person's goal would be. So if their goal is to maximize overall calories, I wouldn't be so concerned about finding a low sugar protein powder. We want, if we're concerned with calories and wanting to gain some weight, we are okay with sugar, and sugar will provide a few more extra calories there. But if we are just wanting that protein powder, we want to look for, if your loved one is able to tolerate cow's milk or that protein that's found there, whey protein is probably the most readily available protein powder out there, and probably one of the more cost-effective protein powders out there. And we can find some pretty basic plain Jane whey protein powders out there that'll just provide protein with usually very little fat and very little carbohydrate, which is what sugar is. And I mean, you can even find a basic whey protein that doesn't have any flavorings in it at something like Bulk Barn. And it's a pretty kind of plain Jane option. We do want to look out for some of the protein powders that have added sugar in them. And that's where we want to take a peek at that nutrition facts panel to look at the sugar content in there, as well as often some extra additives, I can say. So things like maybe artificial sweeteners, or if it's, geared towards maybe even weight loss or sport performance, we can get some what's called the manufacturer's proprietary blend. So sometimes they don't always tell you what exactly is in that product. So when we get into some fancier products, can be a bit more difficult to kind of figure out what's truly in there. But yeah, if we're looking for just a plain Jane protein, if your loved one's able to tolerate dairy and cow's milk protein, that's what whey is, and that can be a pretty basic protein powder.
One commenter says, my loved one is a diabetic and she is at the end of stage of dementia. Would I be really watching her calorie intake as she has a total sweet tooth still and is losing weight gradually?
That's a wonderful question and very common. And I do work in long-term care, so this is something that I come across quite often and work with families on regularly. So when we are at the end of life, we aren't worrying about end of life and stage dementia with someone who has dysphagia. We aren't worrying about blood sugars. If we're struggling with weight loss, that's really what we need to focus on. So we want to focus on what the loved one is willing to eat. So if that is just sweets, that's okay. And just want to make sure I'm getting it all. Yeah, and really when it comes to diabetes at the kind of end of life and when we're dealing with dementia and the frail elderly, there's actually some really good clinical practice guidelines around this, and that really the strict diabetic diet and limiting sugar and carbohydrate really isn't kind of necessary anymore. We use medication to regulate blood sugars at the end of life, and we really are watching and preventing any sort of hypoglycemia or low blood sugar. So we want to encourage that intake, and if that's sweets, that's okay.
Another one is, you provided some great ideas for smoothies and the app for tracking their intake. Could you share those?
Absolutely, yeah. So we'll share the link, the Chronometer link, and that's for tracking a website, and I do believe it has an app that's associated with it that tracks our macronutrients, so carbohydrate, protein, and fat, as well as all of our micronutrients, which is vitamins and minerals. So we can definitely share that, and some of the smoothies we can share, as well as even the fruit lax recipe was another one that probably zipped by your screen a little too fast.
Today's inspiration speaker is Jessica Hughes. Jessica is the Associate Director of Bereavement Services for the Central Okanagan Hospice Association. Jessica is a registered counselor and holistic health coach who is deeply passionate about health and wellness and living a life of meaning and purpose. She works to inspire others to live, love, and nourish body, mind, heart, and soul. Jessica has been a part of our staffing team for 5 years.
And welcome. I'm glad everyone's joining today, and I hope what we share is very helpful and you can take some of that back and allow that to enhance your life. So our topic today, I'm going to be speaking a little bit about ambiguous grief, and really that is grieving someone who is still alive. There are times in life when someone we love becomes someone we can barely recognize. Having a loved one both here and not here, physically present but psychologically absent. The person you love is still here but absent, that is physically, emotionally, or cognitively. And there are ranges of reasons this can happen. Some of the most common things are like Alzheimer's disease or other dementias, traumatic brain injuries, addiction, depression, physical illnesses or mental illnesses, or other chronic life-limiting circumstances. A complication of ambiguous grief is that many people do not recognize it as grief. So it can be really hard to open up and share what you are truly feeling. You may feel lonely or isolated when those around you do not acknowledge your grief, or when you do not feel like you have permission to grieve the loss or losses that you are experiencing. So ambiguous grief can bring feelings such as sadness, yearning, anger, guilt, and a range of other emotions. Sometimes the one you're caring for may look sick and sometimes they don't. But regardless, of how they look, they may do things that they would never have done or say things that they would never have said or treat you in ways that they would never normally treat you. So you may feel like, this relationship to this person is different. The person that they used to be, different than what they used to be. They may not be able to be there for you in the ways that they previously were. And the relationship with them has radically changed, and you grieve the relationship you used to have. Some of the symptoms of ambiguous loss, and this is not all inclusive, but, and nor would you maybe experience all of them, maybe some, and this might relate or not, but hopelessness, intrusive racing thoughts, anxiety, depression, anger and irritability, confusion, preoccupation with thoughts of your loved one, difficulty committing to decisions, inability to move forward with everyday tasks, emotional overwhelm, frequent crying or outbursts, insomnia, whether it be inability to fall asleep or stay asleep, difficulty accepting the new family role, and or sabotaging relationships. So some of the things that I wanted to speak about to remember about ambiguous grief is that, remember the present does not override the past. And this can be easier said than done, but it's important to remember that the person your loved one is now does not change the person that they were. Even if their words or behaviors now are difficult or hurtful, even if the relationship has changed and it was different than it was, cherish the memories that you have shared. You can write them down, create a scrapbook of old photos, and try to find some time to reminisce on some of those special times that you've shared. Another thing that is helpful is to remember that the illness is not the person. So it's obvious, it sounds obvious, but it can be tough when someone you love seems like they should be the same wonderful person that they always were, and they're not. Understanding the illness can soften feelings of anger, frustration, blame towards them and or yourself. Acknowledging the grief and pain of such loss is very important. Society may not always recognize this type of grief. It is important that you give yourself permission to grieve and acknowledge and express that grief however you are able to do that. So connecting with others is one of the helpful ways, and that, as Natasha shared earlier, we're offering a support group, and it's a safe, supportive, and confidential space where friends and family, caregivers can share collective experiences. It's a weekly virtual meeting that allows you to participate from the comfort of your own home, and that's on Monday. So if you want to learn more about that, it's at our website, which is www.hospicecoha.org. So you can look there to find more about that. I wanted to share a poem I thought was a little bit fitting, and it's kind of nice to break up some information. So just try to take this in. And it's called Each Day. I don't know the author, but I will read it now. Thank you for my journey, the special time we shared. Elegant and awful, no detail would be spared. We know the destination and try to drag our feet. Try to savor every moment and make each day a treat. We gladly watch a movie, knowing it will end. But life we look at differently as you count each day we spend. Don't forget this journey, full of stories we can tell, if we remember what's important through living each day well. I think that really just speaks about trying to be present. Sometimes we have good days, sometimes we have bad days, but each day is really truly a gift. So in saying that, I just want to speak about, and you will probably get an opportunity if you're able to join us for some of the self-care pieces that we share. But I don't think that it can be spoken of enough. So I wanted to include that as well, that really it's important to take care of ourselves so that we can take care of others. And some of that might look like time in nature, time in meditation or prayer, reading a book, getting a massage or a facial or spa treatment can be lovely to do and very nourishing. Even just getting your hair cut, when we're so busy taking care of others, some of those little things that most of us take for granted, it's important to do for ourselves. Watching a funny movie is a great way to kind of escape for a moment or two. Journaling is important to get some of the things that maybe we're holding out. Time with uplifting friends can't be taken for granted at all. So make sure you're around people that uplift you. Relaxing Epsom salt baths with essential oils is extremely relaxing, and I do it quite often, so I thought I had to include that. Exercise in whatever form is nourishing for you. It can be yoga, walking, whatever it might be helpful. Naps, I'm a nap advocate. I take naps all the time. If you can steal one, it's important. Sleep is so important, and I know it's challenging when we're stressed. So trying to make sure you're taking care of that piece. Saying no and saying yes. So what I mean by that is saying no to things that are energy draining or that maybe you don't necessarily need to take on, and saying yes sometimes to things that maybe you wouldn't, like going for coffee with a friend, is self-care. Healthy boundaries is really important to have, and that's challenging sometimes, but important. Nourishing foods, meals and foods, of course, for yourself so that you have the energy that you need to be able to take care of yourself and others. So making sure you're eating meals. Listening to music is very healthy and relaxing and soothing. So if you can even have some background music, sometimes that can really help. And the last one I'll say about for self-care, and of course there's many more, but asking for help. We can't always do everything on our own. Sometimes we try to do that, and that's when we can go into burnout. So delegate where you can, ask for help, and more importantly, allow people to help you. So I have a little bit more to share, but I did want to just open it up to any kind of questions that you may have. And if there's not any questions, then we can go into a little bit of a self-care piece that I thought I'd share with you today. And before we get to that, I'll just speak into it a little bit. So in the comfort of your own home or office, I'd like to invite you to get as comfortable as possible. I ask that you leave your to-do list and any worries, judgments, or expectations, and join me for a 5-minute guided meditation. I'm going to be playing a song and saying a few words to guide us in, and then allowing the music to play to bring this session to a close. So just so you know how I'm going to be setting this up, I'm going to play some music, say a few words to guide us in, and I want you to really just tune into the music and allow yourself to get as comfortable and as present as you can for this few moments. And I'd also like to thank you for joining us today. I invite you to be gentle and compassionate with yourself as you navigate the daily challenges of caregiving. Be mindful to take care of yourself and incorporate self-care practices that nourish you in body, mind, heart, and soul. And I ask that you let this practice rejuvenate you so that you can continue to give from your heart so freely as you have. And let this practice be something that you continue to do for yourself always. Now let's begin our short guided meditation. Just get really comfortable and close your eyes if you can. You can start to tune into your breath. And as the music begins, I invite you to get comfortable. Close your eyes and allow the music to wash over you. Just get really present with yourself in this moment. Tune into your breath. Breathe in and breathe out. Tune into your heartbeat and the warmth that is generated here. I want you to focus your attention on all the love and care you give outward. I want you to focus that back inward. Focus all the love and care back inward. Let it surround you. Let it fill you. Let it fill you up. You are not alone. You are being held in this pain. We will leave you now with this music. Let it flow.